Good day, everyone. My name is Winifred George. I'm a student of Cook State Medical University, Russia. I'm a first year student and I'm in group 24. We were given an assignment to talk on medical malpractice. So, firstly, we'll be starting with the definition of medical malpractice. Medical malpractice is defined as an act or omission by a physician during a treatment of patients that deviates from norms of the practice in the medical community and causes injury to the patient. Medical malpractice is a specific subset of wrong law that deals with professional negligence. We'll be talking about the types of medical malpractice. First, we have prescription drug errors. Doctors make errors in prescribing the wrong medication. Incorrect dosing and administration of prescription drugs. Other drug errors include prescribing drugs that can cause the harm in the patient when they interact with one another. Secondly, we'll be talking about misdiagnosis. Failure to diagnose an illness is a common medical mistake. The most commonly diagnosed conditions are heart attack and cancer. The failure to diagnose these conditions can have devastating consequences and cause catastrophic injuries, which may not be good. Thirdly, we'll be talking about surgical errors. Surgical errors will occur when the surgical team left a tool or sponge inside the body during surgery. The wrong side or site was operated on and even performed on the wrong patient. Surgical errors are another common medical mistake. This may happen when they leave sponge or tools inside the person's body, or the wrong side or site was operated on, or even a wrong patient with a different disease. That's what's called surgical errors. Now I'm going to be talking about communication in healthcare. First, we'll be starting with the meaning of communication. Communication is a two-way process in which information is shared. Information can be sent orally, in writing, and through body language. Now, communication between staff members must be effective if patients are to receive the safest and best care. Communication between patients and their visitors is also important. The nursing assistants and patients must understand each other. Communicating with patients. Guidelines with communicating with patients. Be ensured to have the patient's attention. Avoid chewing gum or eating or covering your mouth with your hand when speaking. Avoid cell phones and other gadgets. Do not leave a patient while talking with other students. Do not discuss the case with others in another language. Patient may think bad of you. Do not sit on patient's bed. Do not speak about a patient in front of a patient or other patients. Use non-threatening words and gestures that a person is likely to understand. Speak clearly. Use a pleasant tone of voice. Use an appropriate body language. Be alert to patients' needs to communicate with you. Allow time for a patient to talk and respond. Do not interrupt a patient. Reflect patient's feelings and thoughts by rewarding his or her statement as question. Ask for clarification if you are to ensure of what a patient is saying. Give a patient one factual information, not your personal feelings, opinions, or belief. Always inform the patient before you leave the room and be sure a patient has a call signal or other needed items.